Hi, I'm Dr. Jackie here at Oak City Chiropractic, and I'm going to be discussing today a little bit about adjusting and pregnancy and how they go hand in hand. A lot of people don't even know that you can be adjusted during pregnancy, let alone that you can be adjusted from the very first day that you're told you're pregnant all the way up until giving birth. Why do we want to be adjusted during pregnancy? A, to decrease discomfort for mom, but B, to provide an optimal growing environment for baby. How do we do this? We use very gentle adjusting techniques. We can use something called activator, which is a little tool that provides the impulse for us. We can use something called drop piece, which is where the table comes up and drops down. And then we can use manual, very light manual adjusting techniques. I personally like to use a technique called Webster Technique, which is specific for pregnancy. It's a 6-step technique that involves working through muscles, ligaments, and bones. Today I'm going to discuss a little bit more in depth on what specific muscles, ligaments, and bones we'll be working through when you come in. So starting off with the muscles, we're going to be working through the piriformis muscle, which is kind of on the outside of the glute. As women tend to progress in pregnancy, they'll notice more and more discomfort through the low back, but also through the glute region and through the piriformis. So we work through that muscle to help decrease tension. As mom gets bigger and as the pregnancy progresses, she tends to notice a lot of the times that the hip flexors in the front tend to get tight as well. So we'll work through those muscles as well. And then ligaments. Everyone always knows about the round ligament. It's very important, and we're going to work through that as well. So the way that we do that is just providing a very gentle massage to the ligaments themselves to help release them and decrease some tension. We then will work through the sacrotuberous ligament, which is located near the bottom of the pelvic region. Again, that tends to be a little bit more unilateral on pregnant women. Sometimes it's due to the fact of the way that they stand, but most of the time it's due to the fact that they might have a little bit of sacral dysfunction. And then we'll work through the bones. So as anyone knows who's known any pregnant woman, or if you've been pregnant before, you'll probably know that they've had low back discomfort. A lot of the time that's actually due to sacral dysfunction. So the sacrum is shifting one way or another, and that's completely normal. As baby tends to grow, it's just putting pressure on different areas of the body, either on the sacrum, on the pubic region, or even on the internal organs, which is not very fun, which is why we encourage adjusting to help mom decrease some discomfort overall. We'll then work on adjusting the pubic region in the front. As women tend to progress in pregnancy as well, they tend to notice a lot of discomfort through the pubic region. That's due to the fact that baby tends to grow outward and in the front. And so overall, what we're doing again is to optimize the growing environment for baby. A, keeping everything in alignment so that there isn't a sacral bone poking in one region or the other towards where baby's trying to grow, but B, decreasing discomfort for mom overall. If you have any questions about anything that we discussed today, please feel free to reach out. Thank you.